So, what often happens in the springtime for people who suffer from allergies is that their sinuses get clogged. This can happen throughout the year at any time with a head cold. A really simple way to figure out if your sinuses are clogged is to take a flashlight into a dark room and just sort of hold it lit inside your mouth, and you'll find the sinuses light up. There's a little one here, and then another one here at the back, and then a little bit in the forehead that the light doesn't really reach. But we're gonna just walk through a protocol that's designed to release a lot of the congestion held in the forehead, just in the cranium in general. And so to prepare the tissue, it's actually a really nice way to start to do suboccipital decompression. Now, the easiest way to landmark it is just to place your thumbs together underneath the person's head and drag the thumbs towards you, just to give enough of a landmark where those two thumbs touch. We're just going to do a sweep where the three fingers become a wall of each hand together. So you've got 6 fingers just underneath that positioning. The pinky fingers are there as a capital flexion generator, and then you've got the thumbs to sort of stabilize the head. And so just make sure that if they've got long hair, they can stay relaxed. There's nothing for them to do. It's just about kind of creating space. So thumbs together, gonna rotate my hands, find that spot just in the softness between where the cervical spine and the occiput sort of exist. My thumbs are stabilizing the head, and I've just got my pinkies bringing the forehead just down. Ideally, the forehead is above the nose and the chin, and this can last for quite some time. The best way to maintain your stability and your confidence in this posture and make sure that you're not wearing is to press the back of the wrists into the table. Just like any fulcrum, we're using that weight of my upper body into the table to actually generate the work of my fingers into that soft tissue at the back of the skull. And already I can feel the tension there just unwinding, as with each exhale she's softening. We're just watching her head get a little bit heavier, and this is valid to cue. It actually can help people to follow their belly button. The navel descends towards the spine with each exhale. As they inhale through the nose and exhale out the mouth, that jaw unlocking, the TMJ, the temporal mandibular joint, the tongue widening in the back of the throat, and the throat softening. Even a little bit of audible sound is going to help get into the gland, the parotid gland associated with the 10th cranial nerve, the vagus nerve, and just cueing to the body a parasympathetic response. Head's heavier, hands heavier, hips heavier, and the whole body just relaxes on the table. That's good for this because that suboccipital release is going to create a softening proprioceptively, obviously, for the whole head. The suboccipital is being prime awareness in space, but also just to bring greater blood supply to the brain through the vertebral artery and drainage. The venous return is going to be provided or supported through this process. Once we've got that release, we just want to settle them back down to the earth. And we're going to start with the thumbs across the frontal bone and just gently, a little pressure downwards from the midline laterally along that sort of upper frontal bone A couple of times from the midline out. It's important to understand that what we're working with is fluid. So having an understanding of hydrodynamics, we want to work with the sort of fluid to move from that midline. So it doesn't take a lot of pressure, it doesn't take a lot of force. After sort of milking like that, we're going to use very light pressure to sweep away from the midline all along that frontal bone, just so toward the temples. You can work upwards away from the supraorbital. Now, to come into that supraorbital, we're kind of using a pinching motion just to, again, lightly work away from the midline. And along towards the temples. With that palpation, you can find the supraorbital notch and just create a light pressure against it. It's going to generate an analgesic effect. Traveling through the trigeminal nerve. Just to again cue that relaxation through the frontal space. And then coming back to that sweep. We want to drop down to the maxilla, just lateral to the nasal passages. And again, just light pressure against the tissue. We want to generate just a little bit of compression. Trying to push that fluid deeper, wider, and then sweep. Right, from the maxilla, just sort of sweeping down to the corner of the mouth. Thenar eminences against the temporal fossa. And I like to do a really low amplitude, really low frequency pulse. Again, it's nice to have the water in the background here and just remind yourself the way that water works. I'm trying to sense that in this body. Every person underneath my hands is different, and just sort of appreciating that gentle, for lack of a better term, milking effect. We're using the fluid body to mobilize some of what's in the sinuses, but also the sinuses themselves. From here, the same structure, but just at the lateral occiput. So it can be, if you've ever played volleyball, a really nice thing to just sort of, like you're bumping a volleyball. Hands sweep together just like we did at the suboccipital release. But again, just generating a very light amplitude, light frequency, pulsation. The lateral border of the occiput. And just seeing if we can pulse that tissue back towards the venous drainage. Because of the way the cranial bones have that motion, Sutherland, who sort of generated craniosacral therapy out of the teachings of osteopathy and Andrew Taylor Still, observed that the temporal fossa was beveled, almost like the gills of a fish. And that was what started watching this rhythmic impulse. And we're trying to meet that impulse. There's a few of them. It's not too important for this work of draining the sinuses, but if you can sync up with that, dropping into that space and meeting it, it's that much more effective. Now, after some of those pulsations, we're just going to hang out here for about 60 to 90 seconds in a bit of a sustained compression. Very light, focused on the occiput. This counter strain technique is going to generate a bit of relief by creating a contrast, right? I'm giving the body something for it to press up against and encouraging it through that resistance just to generate its own impetus. Hanging out, just listening. It can be nice to cue my breath with their breath. Just noticing that softer depth of breath is often a byproduct of parasympathetic engagement. Just watching the nervous system relax. Just appreciating this longer hold. It can be that the body will guide you into some amendments throughout that upper cervical tract, even just where the head and the neck meet. Feel free just to listen and follow where it's leading rather than trying to sort of gestate your own ideas. It's really key to listen to the body here. Once we've gently sort of eased out of that, following the tissue, letting it sort of rise us out, the left hand is going to stay underneath the occiput and create kind of like a cradle. I like to use my ring and my thumb finger. Middle finger on the top hand just comes down that central axis, and this sort of soft part along the palm is going to meet that frontal bone at its top plate, just sort of along the coronal suture. And again, that gentle pulse, very light. You might find that as the nervous system slows down, it is even slower. Because in this position we have so much access to the spheno-basilar joint, paying attention to that deeper fluid movement and such can be a really nice way to follow it. So watching how the occiput's moving, the sphenoid is moving. Once you've got that, just make sure that you're watching for their inhale. It can be good to cue one just so that it can be a little bit deeper. I like to pull my lower hand out just to give them like some relaxation down. I'm gonna make a bit of a bird through the two hands. The thumbs come together, and I'm just gonna again return to that milking from the front of the nose, just in between the eyes. And just, I like to switch from side to side as I travel down. But I'm essentially just bringing the thumbs together with this sort of bird flying over their frontal bones. And just milking down again from the frontal bone in between the eyes down towards the corners of the mouth. Once I've had that, again, just sweeping from that lacrimal place towards the corners of the mouth. And then the opposite, I'm going to interlace my fingers and bring the heels of my hands along the maxilla, sort of that zygomatic portion. Once I've got that, the compression in towards the midline, and then a lift towards the ceiling. This is where a lot of the work pays off, and a lot of people can find, especially if they are suffering from that lack of drainage in their maxilla sinus, a nice little pop or post-nasal drip, totally normal. It can be good in the assessment or consent phase, just to give people an awareness that this might happen. And just following it. It may be like asymmetrical unwinding. Again, it's nice to just listen and follow the tissue, allowing it to sort of generate that space, that awareness. Once you've come out of there, you're going to take sort of the tips of the fingertips right down on the maxilla, and almost like you're suctioning in towards the center of the bone. You just want to find four corners of that, hold it, and then draw away from the deepest sort of core of the cranium. Think where that sphenobasilar joint is, just at where the head and the neck meet. And as you traction away from that midline, just creating again a little bit of suction out of that depth of the sinus so that it can drain. Really nice way to close out this sequence is just to bring the forehead, the forearm across the forehead, and the thumb and index finger just pinch the bridge of the nose. We're looking to release the frontal bone from the vomer and vice versa. And so just looking for a little bit of depth initially, particularly in the vomer. You can almost press it down, in, and out as you traction the forehead up with your forearm towards my own body. I'm taking that thumb and index finger and their nasal passage down towards the sternum. Very gentle. Again, there's not a lot of agenda here, so much as just initiating an awareness. And again, everyone's different. Some people, you're going to feel a lot of movement right away. Some people, it might take 2 or 3 sessions. And once you've had that release, it's more or less the process. I like to come in just to a cranial vault hold, sort of like a Star Trek thought. Pinky finger goes to the occiput, ring finger goes to the sort of mastoid process. You've got the cheekbone under the middle finger, index finger to the sphenoid, and then the thumb to the frontal bone where it meets the parietal. And this is just a really nice grounding. Again, we're looking for that neutral flow from the midline up and out just in and around that temporal fossil, the sphenoid, watching almost like the wings or the gills of a fish, moving, fluid, and flow. Make sure that that flow is in its state before you step away. If you've found a still point, it's important that you stay in contact with that tissue until it returns, until that motion is back in play. Really important, as much as you can throughout this practice, to maintain your own positioning. I really like to ensure that my spine is vertical. That perpendicular characteristic gives me my own boundary to this person and allows me to remain objective. As well, just a little tuck in the chin. It's like the back of the neck. In the small treatment rooms, it's nice to go right down to the corner of the room and just maintain that composure, almost like a guy wire keeping me in, again, my juxtaposition to the body on the table. And just allowing me to remain objective, to go in and to allow them to gestate the release. I'm just something for them to contrast up against. Hope this has been helpful. Feel free to check out the other videos.